Hello, this is Diagnosis Buona Curazza Buona, and it's me, Dr. Dinara. Today we are talking about Down syndrome, what's the cause of this condition, what challenges they have, and how we can diagnose it during pregnancy. So let's get started. Down syndrome is the most common chromosomal condition that occurs in 1 in every 700 births worldwide. Down syndrome is also called 21 trisomy because instead of just 2 pairs in 21, they have 3 pairs. They have some intellectual disabilities, distinct physical traits like a low muscle tone, upward slanting eyes, and just single crease on their palm. So we know that this condition caused by this 21 trisomy, but what exactly is the cause of this condition we don't know, but there are some risk factors that increase the chance of having such a baby, and the most important one is the maternal age. So the older the women, then they have a high chance to have a baby with a Down syndrome. For example, in a woman who is 35 years old, they have this chance 1 in 350. If she's 40 years old, this chance having this child is 1 in every 100 birth, and if it's 45 years old and older, they have a chance 1 in every 30. So 30 women who will have this birth, one of them will have this child with a Down syndrome. Also, there is a risk if you already had a child with a Down syndrome, or some of your relatives have had this condition. But if you look maybe in your neighbors or some people that you know, most likely it will be younger people, younger than 35, because if we take worldwide, so if we take all population, still women who is younger than 35 have more kids. That's why they have more chance having this baby. So if we're talking about challenges that occurs in these people, it's a congenital heart disease like atrioventricular defect, it's a hole in the heart, and some other conditions. That's why many kids require a surgery in the first year of life. Also, it could be a hearing or vision problems, as well as gastrointestinal problems like duodenal atresia, it's a blockage in the small intestine, and also it could be celiac disease when your body can't digest the food with gluten. They also have a high risk of having some types of cancer and early development of Alzheimer disease. But with the proper and early investigations, medical care, and treatment, they really can have a very happy and long life. So if we're talking about how we can diagnose it during pregnancy, we have some screening tests and diagnostic tests. If we're talking about screening tests, there is a first trimester combined test. Why it's combined? Because we need to take a blood sample and also to do ultrasound. And ultrasound will look for a nuclear translucency. It's a fluid at the back of your baby. The second type, it's an NIPT, which is we do after 10 weeks of pregnancy. And when in this test, it's a non-invasive prenatal test. We look for DNA of the baby in mom's blood. It's quite accurate, it's quite good test. And the third test is a quad test. If we're talking about diagnostic tests, it's a chorionic villus sampling, when you take some very tiny sample from your placenta, or it's amniocentesis, when you take some fluid from the baby. They are more accurate, of course, but at the same time they're more dangerous for the baby, so they have a slightly high chance to have a miscarriages after this procedure. That's why doctor usually do a screening tests, and if they show that there is some possibility of having such a baby, they can recommend to do a diagnostic test as well. Down syndrome comes with challenges, and it's very hard to have a baby with Down syndrome, but let me assure you that with the early diagnosis and proper treatment, it has to be a teamwork, because they requires a speech therapist, physiotherapist. So if you do all measures that this child is required, yeah, so they really can have a very long life, very happy life. So and you know, it's a very unique people which are very capable and deserve of love and opportunities. If you found this video helpful, so please like this video, subscribe to my channel, and if you have any questions or personal experience, please comment down below. I'm always happy to read your comments, and see you in the next video. Bye bye.